Welcome to Recovery Corner, where the many pathways of recovery intersect. This is a space where you will hear personal stories of triumph in recovery, gain insights into various recovery-oriented systems, and learn how leaders across the country are building recovery-ready communities. The Recovery Corner podcast does not provide clinical advice.
All right. So my name is Soraya Sampson, and I am the Director of Strategic Equity for Young People in Recovery. And today I am here with Kelechi. Would you like to introduce yourself?
Sure. My name is Kelechi Ubozoh. I am the co-editor of We've Been to Patient Voices from Radical Mental Health, and I am a mental health consultant, public speaker, and writer.
Awesome. So what inspired you to write and edit We've Been to Patient, and what message do you really hope that readers will take away from it?
Yeah, that's a wonderful question. So my co-editor, LD Green, actually approached me with this book idea and said, a lot of people write about mental illness or mental health challenges, and they talk about us without us, but there's not anything where you hear from the perspective of people who have lived experience of mental health challenges, or as so many people call it, very different things: dangerous gifts, mental illness, mental health issues. But essentially, you don't hear from the people who've been there. And we thought it would be great to have an anthology of different experiences, different approaches, as well as poetry and research about what's helpful and what's not so helpful.
Awesome. So in your book, you discuss the stigma surrounding, mental illness in the Black community. How do you think we can work to reduce the stigma and encourage more people to seek help?
Well, I think the first thing we need to do is create a system that is welcoming to Black people. So the reason there is stigma isn't just because people don't want to get help. I think that's kind of a misnomer. It's because they've witnessed family members and loved ones getting help that wasn't so helpful, help that was traumatic. Also, we have a history in our nation of scientific racism. And so we're impacted as Black people by scientific racism, by this idea. And I mean, it's wild. Drapetomania was essentially labeled a mental illness for enslaved people who wanted to be free. So when you look at the roots of psychiatry, and then this immunity hypothesis where there was a belief that Black people didn't have any mental health issues because they were immune, because they were property and they didn't have property. But this has now become an actual belief that Black people have carried. Oh, like, we don't have that. That doesn't happen to us. We're immune to it. So, I mean, I think first of all is, like, we need to really look at the history and understand why people aren't coming to services and why people aren't accessing mental health care. And then I think the second thing I would say is that people don't do well with labels. When you call something mental illness, when you label things, I mean, and for some people, labels are helpful, but for other people, they're like, that doesn't sound like me. That's not my experience. But if you talk about experiences that we have, I think that can connect us more. Like, are you feeling heavy? Are you feeling down? Are you having trouble sleeping? Are just kind of talking more about the experiences might make people more open to talking about mental health. And people have been more open talking about mental health, definitely after the pandemic or endemic, or wherever we may be with this, wherever we may be in time.
Yeah, absolutely. Oh, that was a great answer. So what can mental health professionals do to kind of overcome some of those challenges and provide more culturally competent care to, people of color?
Yeah, well, one of the things is we need culturally responsive programming, and we also need um, more therapists and more psychiatrists who are Black.
Yes.
We don't have the numbers. Two, we need to recognize that peer support, peer specialists have a lot to offer, and that we should be employing them and engaging in them. And I think people have still bias about people like me who have lived experience of mental health issues supporting someone else. But that's one way to really support a bunch of people, and really have it be meaningful. The other thing is, I have seen really cool programs being funded, like the Confess Project, where they're essentially going to barbershops and have in training barbershop like barbers on how to talk about mental health, like meet people where there are people talk about things, go to beauty salons, train people up on how to maybe talk about mental health, how to refer, how to hold space for people. We can get really creative, and people are, they just usually aren't funded. And it's not always seen as a priority or that Black people
Yeah.
need mental health support. But the rates of suicide for Black youth are higher than they've ever been in 20 years. So I I argue that it's imperative that we have these conversations.
No, I agree. I think now more than ever. So how do you think race, this is a little bit of a different path here.
No worries.
Racism and poverty contribute to mental health problems in the Black community? And what do you have any like specific policy changes you can think of that might help address these issues?
Yeah, so I mean those are it's a big
Yeah.
question. I think sometimes we look at racism, and I don't, Yolo Akili says it really well. And Yolo Akili is the executive director of BEAM, and that is specifically Black emotional mental health programming. And Yolo says that we live in a racist and misogynistic world. We were all raised in this space. So instead of asking like, is this racist? We should be moving to how is racism showing up? Because when we talk about racism, so many people get, oh, that's not me, or my program doesn't do that, or I'm a good person. And we just avoid the conversation because people get defensive. So I think if we even change the framework of like, okay, how are the isms, how are isms showing up everywhere, right? I think that's a place where we could create a framework. And then the other thing is, when we see different policies come through, we don't invite people who have lived experience of mental health issues. We don't invite Black and Brown people
Oh.
to actually talk about the policies, because someone might think, oh, this is a great idea, this will really help people, but then they don't realize, oh, this will also penalize someone. So we give people help, and then we penalize them at the same time, because those who are most impacted by policy are not those who were invited to the table to talk about the policy. So we really need to be looking at our policy and our frameworks through an anti-racism lens. And while everyone was doing that for like an hour during 2020, it if it's not embedded in the practice, it goes away. So you actually have to look at your policies. Like, where are you penalizing folks? How are you using harm reduction, right? If we decide, for example, we're going to have substance use programming for someone, but if they ever use substances, we'll kick them out of the program. On the surface, you might not think that's racist, but we are not actually looking at like, okay, what are these folks dealing with to have them how are we not taking care of folks and then penalizing them if they take a step back? We have to have holistic care approaches, which we don't. We have approaches that are, really like, we're going to penalize you if you do X, and that doesn't help Black people.
No, yeah, absolutely. So, in your opinion, what role can community-based resources and support systems play in promoting mental health and wellness, especially in communities of color?
They have the biggest role to play, I really believe, because if you think of like where people go, those are places where people go. People go to their community-based organizations. They go to their faith communities. They go to music, they go to arts, they go to places that bring them energy in life. So if we could actually fund these places to support mental health, or to start to have the conversation about mental health, then I think we would. I mean, these grassroots organizations are the heartbeat of our communities, and oftentimes they're just struggling to survive or exist, and they're not funded, but they're the place where folks go to the most. I just did a report last year, about it was for it was around BIPOC mental health. And I was talking to grassroots organizations, and they said, we are now a de facto emergency room for mental health crises, but we were never trained to be mental health providers. But it hasn't stopped people from going to them. So instead of being, and they'll do everything that they can to help people. I mean, that's kind of the energy of grassroots organizers or grassroots community-based organizations. They're going to try to find a way to help you. So why not fund them? Why not support them? Why not partner with them, right? If you're a mental health organization or a system, why aren't you partnering with CBOs where people already go to provide services?
Yeah, absolutely. So how can we better support people who are dealing with, substance use disorders, particularly in, the Black community? Yeah, I think that's the whole question. It's
Yeah.
a very big
So
question, I realize.
yeah, it's a big question. And so in terms of my lived experience, I don't have lived experience with substance use, but what I will say as someone who cares about people who have had that experience is that one thing is we have to stop judging folks. We have to realize that this is a coping mechanism. And a lot of people cope with things and maybe they're not labeled a certain thing, but we can maybe have different language around like, do you want to change your relationship to drug or alcohol? Right? Like, and how can we do, again, going back to harm reduction? Harm reduction is really not always like abstinence. You never are going to use something again. And for some people, abstinence is important. For other people, that's not where they're at in their journey. So part of it is how do we meet people where they're at, not judge them where they're at, and talk about what their goals are. And if they enter certain programs, don't kick them out because they might have a slip. We lose people when we punish them for
Yes.
doing things that they're using to cope with life, right? If you're coping with life or something, we have to give folks different coping mechanisms, not just take away something. What are we adding? And asking them, what do they want? We often do things without people, but in the mental health world, it's nothing about us without us from the peer perspective. So how are we involving folks who have used substances or who have that experience, and for them to tell us about their expertise and what's worked and what's not worked for them?
Yeah, absolutely. So what role do you think self-care practices like mindfulness or meditation can play in promoting mental health and wellness?
I mean, I think self-care and communal care, part of it is an individualized, but I think sometimes when we think of self-care, we think of like bubble baths, and
Yeah.
that is definitely lovely, and
Sure.
I appreciate a good bubble bath, but meditation for those who it's helpful to is super helpful. When we do wellness practices, when we unplug, when we slow down, I think if we thought about mental health as physical health, right? Everybody has mental health. What are we doing to promote mental health? And what are things that give people their energy back? What is restorative to you? So those practices might be different for different people, but the practices you mentioned, like meditation, can be really helpful. For other people, it might be music, it might be drumming, it might be dancing, it might be let's talk to a friend when we're really struggling. It
Sure.
doesn't always have to be clinical. And I don't think anyone, healing doesn't belong to anyone. It belongs to all of us. So however we can heal, however we can pour back into ourselves, I say bring in more of that. But rest is a really big one that I think a
Yeah,
lot of folks use
goodness.
a coping mechanism of grinding and productivity, and we
Mm.
don't slow down, we don't pause, we don't rest. And I think that's something that everyone could definitely use more of.
I agree. I think that's something I'm trying to be more mindful of these days.
Me too.
How can we work to reduce the stigma surrounding those who are seeking help for substance use disorders to ensure that especially people of color are met with effective and compassionate care?
Hmm. I mean, reducing stigma, from what I've learned and what I've done, a lot of reducing stigma is seeing people who look like you sharing their stories. In the faith-based community, we might call that testimony, right? We might say, this is where I struggled and this is what's helped in my recovery. I think a lot of people might feel like they're the only person experiencing something, and they're not. But if they don't see anyone who looks like them having conversations about what's impacting them, they might be less likely to get support. And again, the support, on the other hand, needs to be supportive, which we in our book talked about a lot of things that didn't work for us. So you both need, I think, the importance of lived experience, of people storytelling, of people sharing their journey or experiences with substance use. And then on the other hand, you need a there. You need a place where people can go, where they're not judged. And I mean, what I've loved about the 12-step or substance use, a lot of the substance use community, is that a lot of the counselors have had that experience too and can speak from that experience. But in terms of making it accessible, I think talking about the experience itself and not labeling it. I've seen people say, I really want to examine my relationship with substances. I don't know that it's doing, I don't know that this is a great relationship. And so even saying things like, do you want to look at this relationship? Do you want to do things differently versus, are you someone who is a drug addict, right? When you use language like that, it can make people pull back and say, well, that doesn't sound like me. But if you're using language that feels more inviting, first person language, welcoming, that might be a way in terms of how we can talk about it to make it accessible. And then in terms of actually the programming, we need programming that speaks to people, that meets them where they're at, that involves culture, that is responsive, and that is not going to be punitive. Again, I think these punitive measures aren't really helpful.
Mm-hmm. Absolutely. Very, very well said. So what can individuals and communities do to advocate for better mental health and resources for African Americans?
Yeah, I think one thing I would do, or I would encourage communities to do, is like in 2020, a lot of people, a lot of institutions, a lot of organizations, and a lot of nonprofits, a lot of for-profits made a lot of promises about their caring about Black people. They said, this is enough. This racialized violence is enough. We're going to stand up to it. And I'm curious about the follow-up. We're in 2023. What has been done? Have people been making their promises? All those folks who made these public statements, who is holding them accountable? How can we go back and say, hey, part of, racism is actually a factor for putting people at risk for suicide, which I don't think a lot of people know, that racism impacts people's mental health, right? So if you say you care about Black people, if you say that you want to stand up to things, then where are you funding specifically culturally responsive programming for Black people? How are you funding it? How are you supporting it? We can go back to the people who made those promises and say, hey, where are you living up to these promises? And if you're not living up to these promises, how can you start living up to these promises? This is beyond, a one-off diversity, equity, inclusion, training that someone had to get in 2020 or 2021. This is, how are we transforming our systems to actually be responsive to the folks who are most impacted by, anti-Black racism, right? So I think there's a big part in that. And then how are we, and where are Black folks in the design, in the service delivery, right? Because there's one thing to say, oh, we'll fund something, but funding something that is actually going to be helpful, that's going to be supportive. In California, we have something called CDEPS, which is community defined evidence practices. And there are these programs that are all throughout California that are specifically culturally responsive. And so like that barbershop, example I shared before, and there's something called Sisters Mentally Mobilized, where they have sister circles and they hold sister circles and support one another. And you can create your own sister circle so that the idea is that the circle keeps growing with resources and services and holding people and emotions, right? So I think there's a lot of people who are doing good things, but a lot of people don't know anything about them, and they're not funding them, or they're not scaling them. So how can we fund and scale? And I think I would advocate that we should be funding these things. We should be funding these programs, and we should be asking community what they want. And community will tell you what they want. They're not shy, but we don't often ask them when we look at policy. We usually ask them later or say, sign on to this thing that because we need your vote. But we need to be in the driver's seat.
Yeah, absolutely. So great. All right, so this is kind of a tough question, but these are really challenging times. I think the last 3 years have been pretty historic, right? Especially I think for people of color here in America. So, what's giving you hope? What's like keeping you through all of these culture wars and pandemics and all of this mess?
Yeah, I think what's giving me hope is the is the ability to still connect with people, right? I spent 2020, 2021, and 2022 holding healing spaces for Black employees. And that was a bulk of the work that I did. And I was holding these spaces and seeing people gather together and see one another and see that they weren't alone, and that in these spaces were transformational, because we would have yet another murder, and we'd all gather and we would be upset and sad and have all of the feelings that are totally appropriate. And then we would talk about what is healing for us, or how we need to pour back into ourselves. And someone would say, you know what, I really need to wobble sometimes. And then before you know it, we were all dancing on a call. And I think that's the magic of Black people, is that we've had to survive so much, and that's not fair. And I don't want that for future generations. But we also, as a coping mechanism, can find humor, can find joy, can unplug from the nightmare that is around us and remember the dream that we have for future generations and this generation. So I think it's not it's not that things aren't hard, it's that it's not going to take my ability to dream about what it could be, what I want to imagine. So as things go further and further backwards, I know that I'm not alone, and I know that I'm not alone in this fight. So
Yeah.
part of it is advocacy that helps me stay. It's like, okay, I'm going to have to advocate for these rights that are getting stripped away, or against this violence that I'm witnessing. And the other part of me is, you know what, I'm going to rest. I'm not going to burn out, because I'm not going to, I know my previous generations did the best they could. They grinded, they worked, they just never took a breath, and their dream for us has been to breathe. So I'm going to make space, as my ancestors would have dreamed of, not what they did. What did they dream for us? And I believe that is rest and joy and love. So I'm going to hold both, and I'm not going to pretend the other one doesn't exist, but I'm always going to hold on to both. And I think witnessing Black people in Black spaces holding all of that has given me hope, to know, like, I'm not alone, and we are going to figure this out. And it may be very messy and it may be very hard, but we're going to figure it out, and we're going to figure it out together.
Wow. Okay. That was beautifully said. Amazing. Thank you so much. Those are all the questions I have for you. But yeah, what's next? Any new projects? Anything exciting?
Yeah, so my I have a keynote coming up, my goodness, next week. um and my keynote is really about the rise of suicide in the Black community. And I interviewed Black suicide attempt survivors. I'm one of them. I survived attempt in my 20s. And my goal is to demystify the conversation around suicide, so
Mhm.
that folks can talk about it, and so that we don't keep losing people because of it's taboo or scary. And also it's a myth that if you talk about it, it will happen. So the keynote is kind of in like front of mind right now. And I'm doing advocacy at the national level. So I'm going to be working with SAMHSA, and I'm going to be sharing what I believe is helpful recovery, especially for Black folks. So a lot of my work is advocacy or storytelling and research. So that's more. And now I'm coaching, which has been really exciting. I've been
Yeah.
coaching Black employees, and I want to continue to do that. And that just brings me so much joy. So even though I have hard conversations, I'm trying to balance out my work to also have the joyful, how do we pour back into each other conversations. And lastly, poetry. So I am a poet. I My poetry is coming out in a book this year called When We Exhale, and it's all about Black women healing and breathing. And so I'm excited that my poem was included. It's called Unbreakable, and I'm just really joyful about that being part of that collection anthology, and I can't wait to read it to an audience.
Wow. Oh my goodness. Well, thank you so much. I am so excited. I appreciate your
Thank you so
time.
much. Yeah, and I can't believe we got through as much as we got through. You were on it.
I know. Great. Thank you.